Hello out there in YouTube land, and welcome to another neurology video by Dr. Reeves. I want to talk today about a drug called levetiracetam, also known as Keppra. That's the name it's marketed by in the United States. It's a seizure drug. It's been around for a number of years now, and it's gained fairly significant popularity for use. There's some reasons for this. One is that unlike some seizure drugs, you can actually give it by vein. The second is that you can kind of increase the dose fairly quickly. There are some seizure drugs that you really need to kind of start with a small dose and you spend weeks kind of working up to a reasonable dose. And you don't quite have to do that so much with levetiracetam or Keppra. I'm probably going to call it Keppra just because it's easier to say. Now, yes, Keppra does require some kind of building up a little bit over a number of weeks perhaps, but it doesn't take a month or two to get up to a significant dose, like it sometimes can with some other medications. Now, one of the nice things about a drug that you can give by vein is that in an emergency, when the person can't take something by mouth, you can give it by vein. That makes it easy. So Keppra has kind of become a little bit of a favorite, at least in this part of the world, for administering in the emergency room when somebody comes in with seizures that are either unexpected or they're very prolonged or something like that. Now, let's talk about the beneficial effects, seizure control. Let's talk about some effects that aren't beneficial that seizure drugs are often used for. So, for example, certain seizure drugs are used for pain, certain kinds of pain. Keppra, not so much. Certain seizure drugs are used to treat some psychiatric conditions. Keppra, not so much. Certain seizure drugs are used to reduce the frequency that people have migraines. Again, Keppra, not really. Now let's talk about some of the bad effects of Keppra, which is probably what many people are interested in. I always like to put side effects of medications into several buckets, kind of just the way I think about them. One bucket is this bucket of side effects that is common to all seizure medications. If you take enough of any seizure medication, you get tired, your balance is changed, your thinking is slow. You just kind of, some people feel like they've drunk alcohol, and not in a good way. So that kind of slowed thinking, fatigues, poor memory, that's common to all seizure drugs. Keppra has it too. It's not extraordinarily bad in terms of those side effects, at least in comparison to some of the other seizure medications that we have. And then there's the little bit more specific to that medication bucket of side effects. And here's where we talk with Keppra, a lot of times we have to talk about a change in thinking, a change in really behavior. Any seizure drug can change your behavior, yes, but we do see problems with being real angry or irritable. A little bit more rarely, people may be suicidal with Keppra. Yes, most people are fine, but some people are not. So this is in the list of things that we would watch out for starting the medication. I will tell you, I've had to take a number of patients off of Keppra simply because, not that it wasn't controlling seizures, but they come back to the office and they or a family member or friend says, wow, their behavior is really different, and just, I think one person said, I don't need a reason to be mad. Just happens. So that's something to look out for. Again, not everybody gets that. I have patients who take Keppra and they just think that's the best thing in the world. They will come in. Some of them say, I have no side effects. My seizures stay away. Isn't this fantastic? Why wouldn't anybody use this? Well, the answer is we're all wired a little differently. We all respond to the chemicals and the medications differently. So the caveat is always your mileage may vary. And then there's a third bucket of side effects which are kind of can happen with any seizure drug. Unusual reactions, particularly unusual and maybe dangerous reactions, say severe rash, something like that. We could talk about Stevens-Johnson syndrome or some other very severe rash. That's actually quite uncommon with Keppra. They sling around Keppra quite a lot in the emergency rooms and clinics across the country, and people don't have rash and other really severe side effects. Kidneys shut down, liver shut down, that kind of stuff isn't really that much of an issue. So in that regard, Keppra is serious. That was a little silly. How am I going to splice that out? In that regard, Keppra is a bit safer than drugs that we used 20, 30, 40 years ago. I'm proud to say I was not practicing medicine 40 years ago. Thank you. So that's a quick rundown of some things to think about and to look out for taking Keppra. It's not a good drug, it's not a bad drug, it's not a great drug, it's not a terrible drug. It's simply a medication, and we all will react a little bit differently. Yes, most people are like most people. Most people don't have severe things, but they do happen from time to time. And with any medication, we have to keep our eyes open. Well, thanks for watching. We out.
Okay.
Okay.
Oh, wait. Hold
What?
on.
Camera girl's on the struggle bus.
Ah, there we go.
There we go. We rolling?
Yep.
Okay, I gotta show off my Spam bowling shirt. Is that not cool? I don't know if you like Spam. I actually don't really care for it. I don't eat it, but it's a nice shirt, you have to admit. Here I am in front of this amplifier that doesn't work. If somebody could figure out how to fix this amp for me, boy, that would be great. I've been trying to fix it myself. I think it's going to wind up having serious surgery.